Now that you understand how your previous level of dopamine relates to your current level of dopamine and how your current level of dopamine will influence your future level of dopamine, but that shift in perception can be blocked by blocking the shift in dopamine. And so this really speaks to these peaks and valleys in dopamine that I mentioned before, and how your experience of anything is going to depend on your prior experience of other things that evoke dopamine. Big dopamine release makes it more challenging to experience more big dopamine release. So dopamine is one of those things that you don't want too high or too low for too long. It's all about staying in that dynamic range, and that's going to be different for everybody. So for the very savory foods that are now everywhere, those highly savory foods, or I think they call them highly palatable foods, are making more bland foods, whole foods, meaning foods that aren't processed. It's making those taste less good, at least for a while. And all it takes is a short period of time, even just days, 2 days or so, of not consuming any highly palatable foods. And suddenly, broccoli with just a little bit of seasoning tastes delicious to you. All right. So again, this just speaks to the fact that dopamine is this universal currency. It establishes value based on not just what you're experiencing in the moment, but what you experienced in the days and minutes before. Now that you understand how your previous level of dopamine relates to your current level of dopamine and how your current level of dopamine will influence your future level of dopamine, it should become obvious why things like pornography, not just the accessibility of pornography, but the intensity of pornography, can negatively shape real-world romantic and sexual interactions. This is a serious concern. The discussion is happening now. The underlying neurobiological mechanisms you now understand. And this isn't to pass judgment on whether or not people like or don't like pornography. That's an ethical discussion, and it's a moral discussion that has to be decided for each individual by virtue of age, etc. But again, any activity that evokes a lot of dopamine release will make it harder to achieve the same level and certainly the greater level of dopamine through a subsequent interaction. So yes, indeed, many people are addicted to pornography. And yes, indeed, many people who regularly indulge in pornography experience challenges in real-world romantic interactions. You now understand the mechanisms behind what I'm telling you. Now, there are circumstances in which increasing levels of dopamine is desirable and advantageous and clinically helpful. A good example of this would be the drug Wellbutrin, also called bupropion, which increases dopamine and norepinephrine. Wellbutrin bupropion was developed as an alternative treatment for depression because some people who take the so-called SSRIs, selective serotonin reuptake inhibitors, which, as the name suggests, increase serotonin, suffer from serotonin-related side effects. Things like decreased appetite, decreased libido, or sometimes increased appetite, or other side effects that they don't want. And Wellbutrin seems to avoid the sexual side effects. It can blunt appetite and these sorts of things because of the increase in norepinephrine, and dopamine increases levels of motivation and craving, but also can create a state of elevated alertness that can sometimes get in the way of healthy eating and things of that sort. So one has to work with their clinician, as a psychiatrist, it is a prescription drug, in order to find the dosage of Wellbutrin that's correct for them. In addition, things like Wellbutrin bupropion can increase anxiety because of the way that dopamine and norepinephrine are stimulating and tend to place people into heightened levels of alertness. Nonetheless, many people have gained terrific relief from depression from Wellbutrin bupropion, and many of those same people had serious trouble with some of the SSRIs. So it does seem to be a very useful drug in certain contexts, both for depression and for the treatment of smoking, for people desiring to quit smoking. And of course, there are a lot of people out there who are seeking to increase their baseline levels of dopamine without taking any prescription pharmaceutical compounds. And nowadays, there exist a lot of supplements to do that. The two most common ones that are directly within the dopamine pathway are mucuna which is actually a velvety bean whose contents are L-dopa. Believe it or not, the content of this bean is the precursor to dopamine. So mucuna pruriens is sold over the counter, at least in the United States, and it literally is the precursor to dopamine. Meaning if you take it, you will experience very large increases in dopamine. Those increases are transient and very, very intense. And in fact, if you look at the constellation of effects of mecunapurines, what you find is that they're pretty striking and they look a lot like, if not identical to, L-DOPA. The most obvious of those is in the context of Parkinson's disease. There are at least 5 studies that have shown that mecunapurines can reduce the symptoms of Parkinson's disease much in the same way that L-DOPA can reduce the symptoms of Parkinson's disease. And that shouldn't come as any surprise, given what I just told you, that mecunapurines is essentially L-DOPA. It also can reduce a particular hormone called prolactin. Dopamine and prolactin tend to be in somewhat push-pull fashion. When dopamine is up, prolactin is down, and vice versa. Prolactin is involved in milk letdown in women. It's involved in setting the refractory period for sex after ejaculation in males. The reason mating can occur and then not occur after ejaculation is because of an increase in prolactin. Mecunapurines is often used to blunt prolactin, and there are actually a couple of studies showing that it can indeed do that. Mecunapurines has a number of other effects that lie in the sort of sex and reproduction pathway that are worth noting. Sperm concentration, sperm quality is actually greatly increased by mecunapurines. These are kind of curious effects until you understand a little bit more about the biology of dopamine, which I'll mention in a moment. But there are several studies, 4 in fact, that describe how mecunapurines can increase sperm count, sperm quality, and sperm motility. So for those of you seeking to conceive children, mecunapurines might be an interesting choice if you're interested in exploring non-prescription compounds. However, I should mention that anytime you consume a substance that increases dopamine by mimicking dopamine or acting as a direct precursor to dopamine, there's almost inevitably a crash or a reduction in the baseline in dopamine that we referred to previously. So many people who take mecunapurines feel really elevated, really motivated, really alert, all the sorts of things that one would expect from a dopaminergic drug, which mecunapurines is, and then they feel a low or a reduction in drive and excitement and enthusiasm after the drug wears off, just like they would with any other dopamine-increasing compound. For that reason, many people have turned to the use of L-tyrosine. L-tyrosine is an amino acid precursor to L-DOPA, so it lies further up the dopamine synthesis pathway. And nowadays, it's very common, because L-tyrosine is sold over the counter in the United States, that people will take L-tyrosine as a way to get more energized, alert, and focused. And indeed, there are data that L-tyrosine will accomplish that. L-tyrosine is typically taken in capsule form or powder form, anywhere from 500 to 750 to 1,000 milligrams. It is a potent stimulus for increasing dopamine, and the time scale for increasing dopamine is about 30 to 45 minutes after ingestion. Dopamine levels start to peak. The classic study that really nailed down the fact that tyrosine has this effect was published way back in 1983, Journal of Clinical Endocrinology and Metabolism, that directly compared L-tyrosine supplementation with tryptophan ingestion on plasma dopamine and serotonin, tryptophan being a precursor to serotonin. And indeed, what they found is that ingestion of L-tyrosine can increase the amount of dopamine circulating in the blood and in the brain too, of course. The tyrosine ingestion induced dopamine increases within 45 minutes, and they were short-lasting. After about 30 minutes, the effect had dissipated, meaning the levels of dopamine had dropped down to baseline, and even though they didn't look at levels of baseline dopamine